now we'll be continuing our video related to analgesics. This is the part 2 of the video. Last time we have discussed about NSAIDs and acetaminophen. NSAID had a standard drug known as aspirin, but it has many disadvantages like GIT bleeding and increased bleeding time for the users, for the long-term users. Now there was another drug known as acetaminophen. It doesn't come in the category of NSAIDs, and it has an advantage over NSAID that it can be given in a pediatric patient. Hence it will not cause any kind of problem in a patient which is having pediatric patient which is having fever, and it can avoid the complication known as Reeves syndrome. Now here is the another drug category which is known as corticosteroids. Corticosteroid has analgesic properties as well as anti-inflammatory properties. It does not have antiplatelet aggregation property. The negative effect of the corticosteroids are GIT ulcers, immunosuppression. So it can be problematic for the patients who are already suffering from a immunosuppressing condition such as HIV/AIDS, hence it should be avoided in such patients. It also has another negative effect which is known as acute adrenal insufficiency. So a dentist or a doctor must always be aware about the history of corticosteroid for the patient, as if the patient is taking corticosteroid from a long time, they can face acute adrenal insufficiency during the procedure, as the amount of steroid in the body will decrease in a very short period of time due to the excessive stress and fear, and this condition can be fatal. So if the patient, if this history comes that a patient is taking corticosteroid from a very long time, then the patient must be supplemented with the steroidal dose, as they can experience the adrenal suppression, which is a medical emergency. Now another negative effect of corticosteroid can be osteoporosis, hyperglycemia, redistribution of the body fat. The drugs which come under this corticosteroid category are prednisone, hydrocortisone, triamcinolone, dexamethasone. Now let's move towards another category of analgesics, which is known as opioids or narcotics. Opioids does analgesic action, but they are not anti-inflammatory drug. The mechanism of action is they affect over the central nervous system, and they are mu receptor agonist. The standard drug of opioid is morphine. Other drugs in this category are hydrocodone, oxycodone, oxycontin, codeine, tramadol, heroin, fentanyl, sufentanil, carfentanil, meperidine. Now the actions of morphines are meiosis. Now meiosis can be a negative effect because it affects the eyes. Now another effect is sedation, which is a use of this drug. Then it can cause respiratory depression as well. This respiratory depression can cause fatal consequences, and this kind of fatal consequence is not seen in the NSAIDs. So in this respect, NSAIDs are better or safer than opioids. Other negative effect is pneumonia, hypotension, constipation, and urinary insufficiency. Now it is a negative effect of morphine that it causes constipation, but in some cases it can be seen as a useful effect, as this can be used as an antidiarrheal medicine as well. Another negative effect is nausea, vomiting, euphoria, and dysphoria. Another important drug from this category is codeine. Codeine is used for cough suppression, so it is an antitussive drug. Now antitussive word is important as it sometimes it is asked as what is the antitussive drug from the given options. So antitussive means suppression of cough, and codeine, which is a narcotic or opioid, is used in this. The next one is tramadol. Tramadol is similar to codeine. This is also known as Ultram. It is an opioid partial agonist. It is not a scheduled drug. Use great caution in combining with MAOIs, example phenylcine and tramcypromine, something like this. Now there is another drug which is very, it is not very important, but it is a different type of it has a different type of action, so it can be asked in the dental exam. So this is known as fentanyl. Fentanyl is a potent narcotic analgesic used primarily as an IV supplement during the conscious sedation procedure or the procedures that require general anesthesia. It is different because fentanyl is 80 to 100 times more potent than morphine, and it can be available as mouth lozenges and dermal patches as well. So fentanyl is a drug which is 80 to 100 times more potent than morphine, and morphine is a standard drug, so this is important. Another drug which can be discussed in this category is meperidine. The name which can be used for this is Demerol as well. This is an IV supplement for conscious sedation procedures. However, this is much less potent than fentanyl and also quite less potent than morphine as well. Now sometimes there are combinations of narcotics which are used. This is very important when there is a situation of severe pain. So first is Vicodin, Vicodin. Vicodin is used as a combination, and this is a combination of hydrocodone and APAP. Then comes Picocet. This is a combination of oxycodone and APAP. Then comes Tylenol 1, Tylenol 2, Tylenol 3, Tylenol 4. Tylenol 1 is combination of 300 mg of APAP with 8 mg of codeine. Tylenol 2 is 300 mg of APAP with 15 mg of codeine. Tylenol 3 is 300 mg of APAP with 30 mg of codeine, and Tylenol 4 is 300 mg of APAP with 60 mg of codeine. So in these four drugs, the amount of codeine is doubled. So the type 4 Tylenol 4 consists of very high amount of codeine, that is 60 mg, and Tylenol 1 consists of just 8 mg of codeine. Now there is the point of overdose and addiction, which is very common in opioid or narcotic drugs. How it can be managed? Let's see. There are several drugs which are used as an antagonist or inhibitors, or the drugs which, in simple language we can say, the drugs which can be used to decrease or completely warn off the effect of the narcotics or the drug which are used as an addictive element. In this category there are several drugs, among which these are important ones. The important ones are Naloxone, Naltrexone, Methadone. Other than that, there are pentazocine, nalbuphine, buprenorphine. Naloxone is very important because it is an emergency drug. It immediately reverses the narcotic overdose effect. So it is a very important drug, naloxone. The another important drug is naltrexone and methadone. These both are anti-addictive drugs. These are used in the patients which are having addiction of opioid medicine or opioid drugs. So these are used in a anti-addiction therapy. Now methadone is a synthetic formation of the narcotic drugs. Okay, and these are specially given to the patient which are having alcohol addiction. These are pain relieving drugs, analgesics, and provide the relief of pain to that patient whenever required. So the patients which are having opioid addiction can be supplemented with the drug known as methadone, so that they do not go towards the they do not take opioid as a drug for the analgesic action, rather than they will be prescribed methadone. There are two drugs, nalmefene and naltrexone. These drugs are used to reverse as a reversing agent to reverse the respiratory depressive effect of narcotic analgesics. So in naltrexone and the methadone, both are used as an anti-addictive. Methadone can be given to the patient who has narcotic dependency. Naloxone can also be given to the patient which are having this narcotic dependency, and also these drugs can be given to the patient having alcohol addiction. I have mentioned that methadone is primarily used for the alcohol dependency, so that was wrong, sorry. Actually, naltrexone is the primary drug for the alcohol dependency, but methadone can also be given to the patient with this kind of dependency, and both are used side by side. Other than that, there is another implication of naltrexone and nalmefene, which is the reversal of respiratory depression effect of narcotic analgesics. Now, whatever I am teaching or telling you in this lecture are available as notes as well, and those notes are having all these important points in a very proper way where you can easily study that. So if anybody wants those notes, can DM me on my page, which is dentist13, and the link regarding that will be in the comment box as well as in the description box. Now another category of the analgesic is nitrous oxide. Nitrous oxide is also known as laughing gas. This, if you go to a hospital setting, you will be seeing this gas in a blue colored cylinder, and the green colored cylinder will be of oxygen gas. Now, the sensation which occur before the onset of the analgesic or the sedative action of nitrous oxide is tingling sensation in the fingers. Long-term exposure of this gas can cause peripheral neuropathy, which is negative effect of this analgesic agent. Another one is nausea. Then there is minimum alveolar concentration of this gas is 105%. And type of question which I have seen in the practice questions is, one of them is, what percentage of nitrous oxide can be given along with the oxygen? And the answer for that is 30% of oxygen and 70% of nitrous oxide, because normally a person take up about 25 to 28% of oxygen, so it should not be less than 30%, and the rest of it can be nitrous oxide. Then comes the diffusion hypoxia, which is a negative effect of this nitrous oxide. And there is an important point that after the procedure, the patient should be given 100% oxygen for some time, so that any remnant of nitrous oxide can be flushed out of the lungs.